Welcome everybody to the November Research Matters. We're excited to have all of you here today. Just a couple of housekeeping things. If you have any questions, please type your question in the Q&A box. The slides will be sent after the session, and the video is also immediately available by clicking on the link that is in your meeting invite if you want to watch this as soon as this is ended. And the last thing is that attendance certificates will be sent to those who logged in. If you logged into Teams and we can see your name, then you'll be getting a certificate of attendance. If you don't get a certificate and you need one for any reason, please email us at hrpp@utsouthwestern.edu and we'll be happy to help you out with that. Today, we have Stephanie Francisco, who is a senior regulatory analyst, presenting on Irb Basics. What is the Irb and what is its charge? This is going to be the first in a series for the rest of the year that really dives deep into Irb processes, and we're excited to have Stephanie here. And with that, Stephanie, I'm going to go ahead and turn it over to you.
All right, thanks, Josh. I appreciate it. So yeah, welcome to Irb Basics. We're going to talk about everything Irb. It's a brief overview of what we do. So to start, what is an Irb and what do we do? So an Irb is an institutional review board. We are a federally mandated committee charged with the responsibility to review proposed research in order to ensure the rights of research participants are protected and that the risk of harm to participants is minimized. So our authority of the Irb is outlined in the UT Southwestern policy that's referenced there. And once approved, the Irb determinations are presented to the institutional official, or our IO, who is the ultimate has the ultimate approval authority that is vested for the university. So our IO is Dr. David Russell. And one thing to remember is Irb determines whether the reviewed research activities meet regulatory requirements and standards prior to and throughout the course of research. So now let's talk about a brief history of human subjects research, basically the how and why we have an Irb. So as many of you guys know, the past of human subjects research is not always the prettiest. We're going to talk about a couple of different cases. There's many, many more to talk about, but these are two of the most relevant. And they're not exactly in chronological order, but they are definitely important. So back during World War II, you had the Nazis who were capturing Jewish people and doing research on them that was really unethical. And so this is an example of research that was not regulated or conducted in an ethical manner. So what happened is they took all of those Nazi doctors and they put them on trial, and it was called the Nuremberg trials. And this resulted in the Nuremberg Code, which was our first established set of research ethics principles. So then our next study was so wrong, I don't even want to say the title of it. So we just call it the Tuskegee Study. This study was conducted in the U.S. from 1932 until 1972, and it recruited poor sharecroppers who were not consented. The study used deception and undue influence. So basically, you had poor African-American males who were infected with syphilis, and they were not given the approved treatment for syphilis, which was penicillin, which was approved in 1945. So they withheld treatment to subjects. So these two cases and many, many more, like the Willow Book study and so many more, resulted in 1974, the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research was established by the National Research Act to oversee human research. So what resulted from that was in 1979, the Belmont Report was established, and it gave us 3 guiding principles for research regulations. We have respect for persons, beneficence, and justice. So respect for persons incorporates at least two ethical convictions. First, that individuals should be treated as autonomous agents, and second, that persons with diminished autonomy are entitled to protection. The principle of respect for persons thus divides into two separate moral requirements: the requirement to acknowledge the autonomy and the requirement to protect those with diminished autonomy. Beneficence is that the principle that persons are treated in an ethical manner, not only by respecting their decisions and protecting them from harm, but also by making efforts to securing their well-being. Two general rules have been formulated as complementary expressions of beneficent actions in this sense. One, do no harm, and two, maximize possible benefits and minimize possible harms. The last principle is justice. Who ought to receive the benefits of research and bear its burdens? This is a question of justice in the sense of fairness in distribution and what is deserved. There are several widely accepted formulations of just ways to distribute burdens and benefits. Each formulation mentions some relevant property on the basis of which burdens and benefits should be distributed. These formulations are: number one, to each person in equal share; number two, to each person according to the individual need; number three, to each person according to the individual effort; number four, to each person according to a societal contribution; and finally, to number five, to each person according to merit. Now we're going to talk about the IRB purpose, authority, and composition. So the primary purpose of IRB review is to ensure protection for the rights and welfare of research participants by reviewing the criteria in accordance with the criteria for approval. And I've listed the two regulations that we follow. One is from the Department of Health and Human Services, and the other one is from the FDA. So our criteria for approval is something that we apply to every study regardless of the level of review. Our criteria are the risks reasonable? Are the risks minimized? Is subject selection equitable? Is informed consent obtained? Is informed consent documented? Is there an adequate plan for data and safety monitoring? Are there adequate protections for privacy and confidentiality? Now, this last one is only applicable for studies that enroll vulnerable populations. So, are there additional protections for vulnerable populations? Let's talk about each of these criteria. Number one, are risks reasonable and minimized? So the IRB will review the protocol, the investigator's brochure, package insert, those are only if applicable, and the consent document to determine the risk of a study. The information presented in all of these documents must align. And so where do we find this information in the SMART form? Well, one way that we find it is through the investigator's brochure. I've given an example here in section 16. Again, like I said, we find it also in the protocol and the consent document. Let's talk about subject selection and equitability. So what we're looking for are recruitment and enrollment practices fair? Are there any specific populations, genders, ethnicities that are excluded from participation? And are non-English speaking subjects included in the research? If they are there appropriate documents provided for in their inclusion? So our expectation is not that subject enrollment be equitable, but the plan for subject selection to be equitable. Any exclusions, including non-English speaking subjects, must be appropriately justified. So where do we find this information in the SMART form? Well, we look in Form C, that really will tell us about your populations and how you're going to enroll them. Let's talk about informed consent and documentation. So obtaining consent could mean providing a written document, either a full consent document or a letter of information, or verbal consent. If specific requirements are met, the IRB would consider if a waiver of consent would be appropriate. Documentation of consent, on the other hand, means do subjects sign the consent form. So if the PI wants to use a verbal consent or a letter of information, the IRB would consider if a waiver of documentation of consent would be appropriate. So the criteria for a waiver of documentation of consent, the study activity must be minimal risk, and the only record linking the subject to the study is their signature. Verbal consent is not permitted or valid unless prospectively approved by the IRB. The IRB also reads the consent document to confirm consent will be obtained and documented. So where do we find this information in the SMART form? Well, we look in a couple of different places. Question 6.8 will ask if the PI is planning to get written documented consent from every subject. And then we also look in section 25 to see if the study team has applied for any waivers. Let's talk about data and safety monitoring. So what we're talking about here is the PI needs to state whether he or she will be solely responsible for the safety monitoring of subjects enrolled in the study, or if there's going to be an outside entity. And that could be many different entities. It could be a medical monitor. It could be a DSMB, DSMC, DMC. We have a lot of names for these, but whether there's going to be an outside group monitoring all of the data for all the subjects enrolled in the study. The most important part is that the PI has a plan to analyze and review the data at specific time points. So then the DMC, the DSMB, the monitor, they should always be used when you have large, multi-site, more than minimal risk studies. So where do we find this information in the SMART form? Well, for our studies that are more than minimal risk, that go to the fully convened board, we're always going to look for a Form D. That's going to be in section 6.16. And we're going to review that document and look at the plan. Otherwise, for our minimal risk studies or studies that don't go to a convened IRB, we're going to look for this information in your protocol. All right, let's talk about privacy and confidentiality. So one key thing to remember is privacy relates to people and confidentiality relates to data and private information. So for example, privacy could mean, is your subject being interviewed in a private room? Whereas confidentiality is when the PI has a plan to de-identify the data collected by using a unique study ID for subject. So confidentiality could also mean having appropriate safeguards in place to access the data. So where do we find this information in the SMART form? Well, we look in section 27. That provides a lot of really great questions and places for the study teams to respond with information that will help us understand the PI's plan for protecting subjects' privacy and confidentiality. So let's talk about vulnerable populations. So the 2018 revisions to the Common Rule have only defined children and prisoners as vulnerable populations. Prior to that change, we had pregnant women included as a population, and it's important to note that the FDA still considers pregnant women to be vulnerable. So the IRB, in what we do, we also consider other potentially vulnerable subjects such as students, employees, people from other cultures, among others that could be protocol specific. So it's not just what's written in the regs. We look at protocol specific populations. So where do we find this information in the SMART form? We look in section 7.5. That gives a lot of different options for study teams to tell us what subjects you're planning on enrolling. And we also look in Form C. And then we also have special forms for specific populations, like Form K for children, Form M for prisoners, or Form O for pregnant women. So the IRB has authority and responsibility. We have the authority to approve research once all of the approval criteria are met. We have the authority to require modifications to a secure approval, disapprove research, suspend or terminate research, and also observe the informed consent process, which is somewhat rare, but we'll do it in studies where we want to make sure that the subject and or their legally authorized representative really understand what they're getting into when they want to enroll into a research study. The IRB has the responsibility to require documentation of consent or a waiver or alteration of the consent process. We have to notify the investigator of writing of our decisions in writing, and we have to maintain records. So what does it take to be an IRB member? Our membership requirements, some of them are required by the federal regulations. Federal regulations state that IRBs must have at least 5 members. We have to have 1 member who has a scientific background, 1 member that does not have a scientific background, and that person must be present for quorum. And we have 1 member who's not affiliated with the institution. So in this case, UT Southwestern. Also important to note, if you're going to have a study that is using drugs or devices, we have to have 1 medical doctor on the committee. Our membership must be diverse in experience. So members should represent different ethnicities, genders, cultural backgrounds, and members should have expertise in the research to be reviewed. So our committees are made up of pediatricians, oncologists, statisticians, so many people from different backgrounds, so we can appropriately review every study that comes in. And finally, our members should be representative of the subject populations. So members should have experience dealing with vulnerable populations. And this means, like, if we were going to have a study enrolling prisoners, we would have to have a prisoner representative to be present in order to approve that research. Same thing with studies enrolling children. We'd have to have someone who works with the child population. Let's talk about the IRB levels of review. One important thing to remember is our starting point for any review is we have to determine whether or not the study is minimal risk, no risk, or more than minimal risk. So minimal risk is defined as the probability and magnitude of harm or discomfort anticipated in the research are not greater in and of themselves than those ordinarily encountered in daily life or during the performance or routine physical or psychological examinations or tests. This is a really fancy way to say, are subjects going to be exposed to something that is more dangerous than their everyday life? That can change from subject to subject and study to study, but this is our starting point for all research. So some research we consider to be no risk and does not really come under our review. Examples of that research is non-human or non-regulated research. This is where you're going to use your forms Y1 or Y2. This is a courtesy review that's done by the HRPP, and it's done because these types of projects don't fall under IRB oversight. Examples of these types of reviews are non-regulated, so this could be quality improvement, quality assurance, health surveillance, or program evaluations. And then non-human research would be considered deceased subject research, leftover de-identified specimens, commercial cell lines, and or data and specimens received from a repository that is de-identified. So one important thing to remember is that when we issue a letter for this, this is a determination, not an IRB approval. There's no expiration for these types of projects. So if you're interested in doing research like this, you need to send your completed Y1 or Y2 form to hrpp at utsouthwestern.edu. And if you have any affiliated institutions like Children's or Parkland, we're going to copy them on that determination. So let's talk about the levels of review that actually does come to the IRB. So we have 3 levels. We have full board review, expedited review, exempt review, and I left a really cute little cartoon on there for y'all to laugh at for a moment. So it's important to remember that the IRB is not a scientific review board. So keep that in mind when we go through these levels of review. First is exempt review. That means that the study is exempt from IRB review, right? No, well, actually, not really. Exempt for review just means it fits into one of our exempt categories. These studies must be little or no risk to subjects. Research must fall into one of these 6 categories: educational research in an accepted educational setting, survey research or interview research, benign behavioral interventions, secondary research, so like chart reviews of health-related data collected with identifiers, public service or demonstration projects, and taste and food quality evaluations. So examples of exempt review would be, like we said, chart review, secondary research of biospecimens, and then maybe comparing evaluation of educational method or surveys of adults. It's important to remember adults there because children would be in the exempt review category. So these studies are submitted via IRB, EIRB, and then they're reviewed by an HRPP staff member. Informed consent is always ideal. We always say try to consent when you can, but for these studies, it's not required, and consent waivers don't apply. However, HIPAA still does. There's no expiration for these studies, and they cannot involve drugs or devices that are regulated by the FDA. Also, these studies cannot include prisoners. So our next level of review is exempt review. This requires prior IRB approval. These studies must be minimal risk to subjects, and these types of reviews can also include modifications, even mods for full board studies. These are minor changes that can be reviewed by expedited review. So research must fall into one of these 7 categories. Research on drugs or devices, if an IND or an IDE is not required. Blood collection, please remember that amounts and timing limits do apply. Collection of biological specimens. Collection of non-invasive data. That means studies that don't include radiation. Collection of data, including specimens that are not eligible for exemption. Collection of data via recordings, so audio recordings, video, photographs, survey or observational research, and then continuing review of research previously approved by a convened IRB, or continuing review of research not conducted under an IND or IDE application where categories 2 through 8 don't apply. So examples of expedited review could be a prospective clinical data and biospecimen collection, surveys of children, or chart reviews not eligible for exemption. So these studies, again, are submitted through EIRB, and they're reviewed by one single IRB member. And prior to the changes of the common rule, expedited studies were approved for 1 year and then required reapprovals, so continuing review. Now, after the change to the common rule, they don't have an expiration date unless they're under the purview of the FDA. Now, our last level of review is full board review. These studies require prior IRB approval. They could be minimal risk or more than minimal risk. The research won't fit into any of our 7 expedited categories. This applies to most clinical trials, and this is also any research involving radiation, anesthesia, other invasive procedures like biopsies or anything like that. These studies are usually approved for 1 year and require reapproval or continuing review every year. So I just want to remind everybody to keep in mind that there's going to be upcoming research matter sessions that will take a deeper dive into all the different submissions that come to the IRB. So speaking of submissions, let's talk about different submission types. These could be new studies, continuing reviews, modifications, reportable events. New studies, all submissions start in Velos. So it's important to remember to have these types of items for your studies. Please keep in mind that not every study is going to have every single one of these documents, but these are just the general ones. So we're going to do a brief overview of this. Make sure that all of your study members are up to date on their HSP and GCP training. GCP training may not apply to every study, but all training must be current within the last 3 years. Other important documents to have in your study are the protocol, or Form A, consent, Form E. For all of our more than minimal risk going to full board studies, the data and safety monitoring plan, Form D. Any recruitment materials that you're going to use, that's Form I, and any data collection forms, questionnaires, assessments, we all call those Form J. Make sure to include on all studies Form C, so we understand your population and recruitment plan. If you're enrolling vulnerable populations, so again, K for children, O for pregnant women, L for cognitively impaired, we need to see all of those forms included. If you're using a drug or device, we need to see a Form S, T1 or T2 to include the package insert or investigator's brochure. And also we need to see a Form H to understand when you're accessing medical records. Do you need a full waiver of HIPAA authorization or just a partial waiver for screening and recruitment purposes? So let's talk about continuing reviews. A continuing review should be the current state of the study. So please, guys, don't wait until the day before your study expires to submit your continuing review, as there's no grace period. Important things to include in this type of submission: make sure that the current state of the study is correct. If you select that the enrollment is closed, please give us a reason in section 3.1. Also remember that your HSP and GCP training needs to be current for all study team members. So again, that's current within the last 3 years. Please make sure that your enrollment numbers are accurate. Enrollment should never go down, it should always go up. So if vulnerable populations are included in the SMART form, please be sure to report that information in section 2.5. If the parent SMART form indicates that a translated version of the consent document will be submitted, then make sure it's submitted. Summarize all UPERSOs and deviations. Please don't send us a log of those events. And finally, we're going to check the charter of your DSMB to see how often they meet. Please make sure you reach out to your sponsor and obtain the DSMB report before your continuing review and include that information for us to review. Again, not applicable to all studies, but ones that do have that, we're going to look for this information. Let's talk about modifications. So the most important information to include in the modification is what is being modified, and more importantly, why is it being modified? So many times we get an answer of why it's being modified is because the sponsor sent us an updated document. Well, that's not a good reason for us. We want to know why the sponsor changed the document in the first place. So important things to remember for this type of submission: if changes are being made to the protocol, are changes needed to the consent document? If the sponsor sent an updated investigator's brochure that has newly identified risk, these are not considered minor modifications. This needs to go to a convened IRB. If you're adding study personnel, please make sure that their city training is up to date. Please remember to update the parent SMART form when applicable. When submitting study documents that have already been approved, please make sure you use the most recently approved versions to make your revisions. And also, if you're submitting a non-English version of a document, please include a Form Z1 or Z2 to certify that translation. Let's talk about UPERSOs. So, the most important thing to do is use the reportable event resources and tools that are included on our website. I've also left links on this presentation. We have the reportable event summary table, non-compliance decision tree, and the UPERSO decision tree. These are wonderful resources that are going to help you to make decisions on what to report and when and to whom. To whom. UPERSOs are incidences, experiences, outcomes that meet all three of the following criteria. Is the event unexpected in nature, severity, or frequency? Is it probably or definitely related to participation in research? And does it suggest that the research places subjects or others at a greater risk of harm, including physical, psychological, economic, or financial, legal, or social harm than was previously known or recognized? Again, all three of those criteria must be met to be considered a UPERSO. So you need to promptly report UPERSOs to the reviewing IRB. And that means if you're relying on an outside IRB, you need to make sure that you're reporting via their regulations or their policy for reporting. So here at UT Southwestern, that means you need to report within 5 days of discovery. So UT Southwestern IRB, our IRB has to send determinations of UPERSOs to OHARP for federally funded research, to the FDA for studies conducted under an IND or an IDE, and to the DoD for studies that were funded by the Department of Defense. So let's talk about reporting non-compliance. Non-compliance is any failure to follow federal regulations and state or local laws, IRB requirements and determinations, or institutional policies and procedure governing human subject protections. Non-compliance is anything that is serious or continuing that requires prompt reporting to the IRB or your outside IRB. Again, rely on their policy. So at UT Southwestern, prompt reporting means 5 days within discovery. And our IRBs and our IO, any determinations of noncompliance, of serious or continuing noncompliance, we have to submit these reports to OHARP for federally funded research, to the FDA for any research conducted under an IND or an IDE, or to the DoD for for studies funded by the Department of Defense. Now, finally, let's talk about inactivation. Like, when do you submit a study closure? So when is it appropriate to inactivate your IRB approval? This is when enrollment is permanently closed to new subjects, no research procedures are being completed, and the use of identifiable data is no longer needed. Data, private information, and/or clinical specimens are no longer being collected for research purposes, and this includes long-term follow-up. Subjects are no longer being treated under the research protocol, and this includes no plan for future research treatment. Research assessments or procedures are no longer being performed, and this includes no plan for future research procedures. Data and or specimen collections have been completed locally, or if analysis continues locally and the data has been permanently de-identified. Federal research funding for the study is closed. This is only if it's applicable, and the study is closed at all participating sites. If this is a multi-center study where UT Southwestern is the lead operations center, and the UT Southwestern investigator is the lead investigator. All right, so this brings me to my last slide today. So do you guys have any questions for us now? Now is a great time to put these questions in our chat. If you want to ask us questions outside of research matters, please, email us at hrpp@utsouthwestern.edu. We'll be happy to answer any questions that you may have.
Thank you, Stephanie, and what a wonderful job of going over the purpose of the IRB, the approval criteria that we consider, the types of reviews and types of submissions. Thank you. We did get a question wondering about waivers that would need to be submitted for access to medical records. And I just want to remind everybody that we did cover consent waivers and waivers of HIPAA authorization in February of 2020. Those slides are still on our website. If you go to the HRPPO website, click on training and then click on Research Matters, you'll be able to watch the video of that presentation and find those slides. And as we go through the future sessions, we'll be looking at, like Stephanie said, exempt studies, expedited studies, full board studies, and as appropriate, we'll cover consent waivers and waivers of HIPAA authorization as it would apply for those particular studies. We did just get a question. And Rhonda, are you seeing that question? Sorry, everybody, we're just coordinating here on the back end.
Yeah, so the question, sorry about that, Josh, was about if the PI did not use the local IRB approved WIRB informed consent to consent patients, is that non-compliance that has to be reported immediately? She did use the WIRB approved consent. So first of all, just for clarification, if you're relying on WIRB, your local IRB, UT Southwestern, is not your IRB on this study. We're just your HRPP. So we do an institutional review and look at some other things that are just required local language, but WIRB is the IRB, and so that consent form is ultimately approved by WIRB as your IRB of record. So if you use the consent form that was approved by the IRB, that's not a non-compliance with regulation. It could be non-compliance with local institutional policy and something that we would just want to take a look at. So if you want to send an email to myself or Kelly Benton, we can certainly look into that a little more closely for you.
Thank you, Rhonda. Any additional questions? Just want to give people an opportunity to type those out. Okay, I'm not seeing anything else come in. So as Stephanie had said, we're happy to help out with anybody who has questions. You can email hrpp@utsouthwestern.edu. You can also contact any of the staff directly. I just, something I probably should have mentioned at the very beginning, I just want to remind everybody who works at UT Southwestern or an affiliate, the HRPP office is still mostly remote, as is most of UT Southwestern, as we remain in phase 2 of reopening. And that means that if you try calling the office, we will get your voicemails as emails sent to us, but we will not be actively answering our phones because we are at home. So if you need to get in contact with somebody quickly, I would recommend potentially sending an email. We heavily use Teams, and we're happy to interact with study teams via a Teams chat, and or you can call us, leave a voicemail, and we'll try to get back to you as quickly as possible. We're still getting a lot of comments that people are calling, 10 to 20 people within the office and nobody's answering, and it's just simply because we're mostly at home. If there's no other questions that we see pop up in the next couple of seconds, then thank you everybody for attending. Thank you, Stephanie, for a great presentation, and everybody have a happy and safe Thanksgiving, and we'll see you again in December.